Hey, this is OT Steph, and this will be my first video on what is hopefully a long series of YouTube videos, basically coming on here and talking a little bit about my job, maybe being able to offer some advice. So I figured for my first video, the best way to start out would be to explain what is my job. Occupational therapy. It's not uncommon that you may not have heard of occupational therapy before. Usually when I first tell people what I do, the first question I get is, hey, well, can you help my cousin find a job? And it's not really about finding jobs. Occupational therapy is a therapy where I get to work with people, and I get to work with them on a holistic level, meaning I get to look at the entire person that I'm treating instead of just the ailment. So the best way I can explain this is, let's say somebody breaks their arm and they go to the doctor, and the doctor's like, okay, you need to go get therapy to, help get your arm stronger and get it working the way it was before. Physical therapy, which is the more well-known therapy, is going to focus on getting that arm stronger. When that person walks in the door to see a physical therapist, that physical therapist is going to look at that arm. They're going to want to make it stronger. They're going to want to make sure the bones are healing correctly, all that good stuff with the arm. Occupational therapy, I get to, when the person walks in the door, with their arm, I get to look at the whole person. So I don't just say, how are we going to make that arm better? I get to say, what is it that you need to do? What do you want to be able to do with your arm, once it's better? Or if it doesn't get better, how can we help get you back to doing the things that you used to do? So occupational therapy really kind of gets to look at the whole picture and not just the ailment or the disease or whatever you're treating. And that means that not only do I get to work with people on, strengthening, making them stronger, regaining new skills, but I also get to help them find ways to do things that they weren't able to do before. And that might involve getting them some equipment that will make it easier for them to, say, take a shower, or, sorry, my cat decided to join the video, to take a shower, or maybe some equipment that makes it easier for them to put their socks on, because not all ailments, not all disabilities are able to be fixed or cured. I mean, that is obviously always going to be the aim and the goal, but unfortunately, even with modern medicine and everything, sometimes someone just needs a different way of doing something. And that's my job. It takes the whole picture, and if your whole thing, your whole life is, you're on a bowling team, let's say, and your whole life is bowling, and that gives you meaning, that gives you purpose, you just want to get out there and bowl again, but for some reason now you have this ailment or disease or a physical trauma that's stopping you from doing that. How can we get you back to doing that? So really, occupational therapy can be a whole team approach to, working with physical therapists, working with speech therapists. Depending on the discipline, you could work along with psychologists, nurses, doctors, the whole 9 yards. So, I really love my job. I think it's really cool what I get to do, how I get to look at things in a completely different perspective. My full-time position focuses on kids, and some of the things that I see with the kids are obviously different from the things that I'm going to see with adults. So with children, a lot of times parents bring their child in to see me to help them kind of navigate ways to rehabilitate for all different kinds of diagnoses. I see children with cerebral palsy, I see children with intellectual disability, I see children who may just have some handwriting difficulties and are really struggling with the handwriting aspect. I see children, one of the primary diagnoses that I see is ASD, or children who are diagnosed on the autism spectrum. So that is kind of, and the child encompasses a whole lot more, you might have different diagnoses going on, and you kind of help support them as they grow and they learn new skills. If a child has special needs, they may need a little bit more attention, or maybe some special equipment, or maybe just, some practice or different tools or activities that they can do, that they can follow through with to kind of help them succeed and grow and develop and, get them as close to independently functioning as possible. So occupational therapy is not to be confused with speech therapy or physical therapy. So all the professions, they all kind of work very closely together, and they all have similar goals in mind, to increase the child's functioning, increase their independence. But we all sort of take different approaches. So physical therapy, like I talked about a little earlier, they are going to focus, and I'm not a physical therapist, so this is a very broad view. I'm sure a physical therapist may answer this question a little differently, but just from my observation, their focus is getting the child stronger. A big thing is being able to help the child learn to walk or have some sort of mobility training if they might not be able to walk. Things like balance, things like endurance, being able to go for a long time without getting out of breath. That whole thing, just the strengthening, the endurance, the balance, the being mobile is a huge thing for physical therapy. Speech therapy, they do quite a bit. They focus on the ability to talk, the ability to form words with your mouth. A lot of the, pointing to my mouth, a lot of the ocular motor function, the difference between a f and a v sound. They will work closely with the kids on that. But they also work, since ocular motor is a huge part of what they do, they can also work on feeding and being able to chew food, swallow food, all that stuff is also part of speech therapy. And on top of that, they also can work with language. So if a child is able to pronounce the word, that doesn't necessarily mean that they understand the word, or they understand that if they put this word and this word and this word together, it makes a sentence. Or, all the way up to complexities like understanding sarcasm and colloquialisms and all that kind of stuff. So they have a huge range too. So occupational therapy, I feel like it kind of fills in the cracks between the two. So I'm going to put up this little list here just to make it a little easier. So occupational therapy, we focus on a whole lot of stuff. It's definitely not just one thing. Fine motor is a huge part of what we do. So anything from being able to write, being able to draw, being able to hold a pencil, cutting with scissors, opening buttons, opening containers, anything you have to do with your hands. Because if you think about it, you use your hands every day. I mean, they're a very important part of your ability to do almost anything. Open doors, get dressed, drive a car, so fine motor is a huge part of what we do. But fine motor may be going okay, and maybe the problem is your ocular motor function. Maybe, everything's going okay, but when you try and look for something, your eyes don't quite want to work the way that they should or follow what they should. So we can also work on evaluating for and treating an ocular motor function problem. Sensory processing, that is a huge difficulty for children who are on the ASD spectrum. I said that wrong. Children who are diagnosed with ASD, not exclusive to that, but it is a huge problem where, seeing lights and hearing sounds and feeling things on your skin, they just don't have the right, the processing of all that information in their brain. It's disordered. There's something wrong with it. So we work on trying to kind of help that so that when they get sensory information, they're able to kind of work with it a little easier. Activities of daily living, I'm going to go ahead and take this off now since I'm sure you've seen it. Activities of daily living, things like dressing, being able to feed yourself, being able to bathe yourself, toilet training, all that glamorous stuff we also help work with. So I mean, whatever the problem is, it doesn't really, if it's a vision problem, if it's a hand problem, maybe you just don't have the coordination in your hands. If it's a sensory problem, it may be an executive functioning problem where you're unable to sequence a series of events or think about it in a certain way to execute a task. Occupational therapy gets to go ahead and look at the child as a whole, figure out where the problem might be coming from, and then try and treat it, that specific problem. And it could be more than one. So for a quick example, let's say a child is having trouble buttoning. Something simple, just having trouble getting that button through the slot and pulling it through. I would look at that child, I would say, okay, I can see that they're unable to do this button and they should be doing it, it is an age-appropriate task for them. So I would look at that and I would try and find out, okay, is it a problem with their fine motor coordination? Are their fingers not strong enough to pinch the button to pull it through? Is it a problem with their vision? Are they unable to actually focus in on the button, which obviously that would make it hard to put a button through? Is it a problem with their attention? Is it that when they're sitting, they're unable to focus what's on in front of them, and they're, everything around them is just too distracting that they can't find that slot with that button? It could be a problem with just behavior. Nope, doesn't want to do the button. Maybe they could do it, but I don't get to see that, and they won't do it at home because they just don't want to, which, obviously could pose functional problems for them now and in the future. So whatever the problem is, it is my job to find out why they can't complete this task and then start working on it at a much smaller level, building up to eventually being able to do that button, being able to help the child be more functional in whatever it is they need to be more functional with. So now that you've seen this video and you know what occupational therapy is, then, maybe spread the word. Let other people know what occupational therapy is. Let them know that it's out there, that a lot of people don't know that this service is out there, especially for their children who might be struggling to complete tasks and things. There are therapists there that it's our job to help them and help you help them, to educate the parents on the strategies I'm using and the tips I'm using to help them help their child. So yes, stay tuned. Check back on my channel for more videos. This is OT Steph is the name, and occupational therapy is the game. And I'm very excited to be able to share all this stuff with you, and thank you for watching and tuning in. Okay, bye.